My name is Eigil Samset. I am the Chief Technology Scientist for Cardiology in GE Healthcare, and I'm also a professor at the University of Oslo in Norway. I joined GE Healthcare because I found that it is the best way for me to have a positive impact on healthcare. As a researcher and supervisor of PhD students, I contribute to uncover new knowledge, disseminate it to other researchers, and contribute to the education of tomorrow's engineers and developers. I have supervised 12 PhD students so far to successfully defend their thesis on topics that have pushed the envelope of what is possible within medical image processing, visualization, and artificial intelligence. As a member of the GE Healthcare Product Development Organization, I help turn research results and new developments into products that can be used in patient care. GE Healthcare is an innovation factory. We transform knowledge into clinical practice through product development. I also have the privilege to work closely with world-class clinical researchers, both globally and here in Norway. At Rikshospitalet, we are just starting a new project called ProCardio. It is focusing on prediction of disease progression in cardiology. In this session, we will focus on the management of chronic coronary artery disease. I will walk you through the pathway from early detection, diagnosis, and treatment to follow-up. We will take a look at each step of the pathway and discuss the role and value of GE Healthcare's cardiology product portfolio. Coronary artery disease is the leading cardiovascular disease burden worldwide. One person dies every 86 seconds in the United States from coronary artery disease. About 366 Americans die from coronary artery disease each year, and about 18.2 million adults aged 20 and older have coronary artery disease. Coronary artery disease is also a major comorbidity driving other cardiovascular diseases. 73% of heart failure patients have coronary artery disease as a comorbidity. 65% of valvular disease patients have coronary artery disease as a comorbidity. 46% of atrial fibrillation patients have coronary artery disease as a comorbidity, and 42% of peripheral vascular disease patients have coronary artery disease as a comorbidity. Now, let's take a look at this video.
Accelerate the exceptional when you triage chest pain patients. Own quicker, accurate insight, and apply it at every contact. Untether your team to excel under strain, so you replace time to treatment with speed to recovery and help raise patient outcomes at an unparalleled rate. Let's help your chest pain teams operate at a higher level.
The development of atherosclerosis from early onset to symptomatic coronary artery disease can stretch over decades. When a patient with chronic chest pain shows up in the emergency room, some of the key questions are: what is the likelihood of coronary artery disease? Where in the disease progression is the patient? And will the patient benefit from revascularization? We will define the pathway in 4 phases: early detection, diagnosis, treatment, and follow-up. We will look into each of these through the lens of the tools GE Healthcare offers in our toolbox to image, monitor, guide, and document the disease. When developing a care pathway approach to coronary artery disease, the key in early detection is risk assessment, and to establish the probability of coronary occlusion or rule out the existence of coronary artery disease. Risk factors including age, gender, high blood pressure, low density lipoproteins, blood sugar, obesity, and smoking. The first step in the pathway is to complete a medical history of exam and labs. Subclinically, risk assessment will help to put preventive measures in place. For symptomatic patients, establishing the probability of coronary occlusion will guide the choice of further diagnostic examinations. To assess the subclinical risk of coronary artery disease, coronary calcium scoring can be a great tool. Coronary artery calcium, as measured by CT, is a highly specific feature of coronary atherosclerosis and a great modality for early detection. CT calcium scoring has emerged as a widely available, consistent, and reproducible means of assessing risk of major cardiovascular outcomes, especially when planning primary preventions such as statins and aspirin. In this 10-year population follow-up study, event rates in those with calcium score equals 0 range from 1 to 6%, while for those with calcium score more than 300, the 10-year event rates range from 13 to 26%. Our SMART score is an advanced imaging software that quantifies and scores cardiac calcium and provides information on coronary artery wall calcium plaque buildup. It automatically detects calcium, highlights it in green, and correlates the resulting score to age group cohort to determine the patient's risk. The ECG can identify patients with possible prior events and other ECG abnormalities suggestive of ischemic coronary artery disease. The GE Muse NX system, our latest ECG management and overrating system, offers the ability to easily compare ECGs and quickly identify if any ECG changes are new or consistent with previous abnormalities. In symptomatic patients, the presence of changes in Q-wave, ST segment, or T-wave abnormalities can increase the pretest probability of obstructive coronary artery disease. This functionality not only identifies patients who need further workup, but prevents unnecessary testing. In a value-based environment, the ability to reduce unnecessary testing is crucial. Echocardiography is an important modality for assessing cardiac function for patients that present with atypical chest pain or symptoms of heart failure. Resting echo can provide valuable therapeutic guidance and prognostic information, which may inform the value of revascularization or contribute to the assessment of pretest probability for obstructive coronary artery disease. Comorbidities such as left ventricular dilation, aortic stenosis, mitral regurgitation, or LV aneurysms and thrombi can be visualized and help predict the risk of cardiac events and death. GE Vivid series offers high-quality echocardiographic imaging and assessment of myocardial strain and early wall motion changes. On-cart artificial intelligence developed using deep learning can recognize standard cardiac views with 98% detectability and provide fast analysis of strain patterns. Detection of early systolic lengthening, decreased systolic shortening, or post-systolic shortening by strain imaging techniques might be helpful in patients with apparent normal LV function, but with clinical suspicion of chronic coronary syndrome. To ensure adequate left ventricular visualization when 2 or more segments are not well visualized, Optison can help assess wall motion abnormalities by pacifying the left ventricle and delineating endocardial borders. For patients with chest symptoms that are atypical for coronary artery disease, a differential diagnosis using chest X-ray can help establish potentially non-cardiac causes. The AMX240 mobile X-ray system is a truly intelligent system which includes the Clinical Care Suite. Clinical Care Suite is a set of AI algorithms for automated quality checks, triage and clinical findings, clinical decision support, and automated measurements. Early detection often requires the review of multiple studies, current and historic, to assess for changes. Access to multiple modalities and previous studies is a key component to effective clinical decision-making. With Centricity Cardio Enterprise, all information is available in one place. Integration of Muse NX with Centricity Cardio Workflow enables a single cardiology patient jacket with the ability to read all cardiology-related studies, including images from echo and ECG, in a single workspace. We know that one of the main reasons for physician burnout is documentation burden. Centricity Enterprise allows a routine adult echo report to be 83% completed before the physician even opens the exam to review. This is possible due to AI-powered automatic measurements and a rules-based engine we call intelligent reporting that automatically generates exam findings and report statements based on measurement values. Now, once pre-test probability of coronary artery disease has been established, the further diagnostic strategy can be planned. Should invasive diagnostic catheterization be used? Should non-invasive imaging be used? Anatomical or functional testing? In a value-based environment, selecting the appropriate diagnostic tool based on the patient's pre-test probability is key. There are two objectives of diagnosis: identify the presence of coronary artery disease and detect ischemic coronary artery disease that requires intervention. Anatomical imaging using cardiac CT angiography is a great strategy to diagnose the presence of coronary artery disease. Functional testing can be done with stress echocardiography, stress cardiac MR resonance imaging, nuclear imaging studies, or fractional flow reserve. The SCOT Heart trial showed that cardiac CT-guided treatment reduced the risk of cardiovascular death and myocardial infarct in patients with stable chest pain. CT angiography can correctly identify patients with obstructive coronary artery disease. For coronary artery disease detection, CT angiography has 94% sensitivity, and it has 99% negative predictive value. Therefore, CT angio can reduce unnecessary invasive diagnostic catheterization. Only GE Healthcare has the first ever dedicated cardiac CT scanner with all the required advanced capabilities, and it is accessible for first-line coronary artery disease decision-making. CardioGraphe is 2 times faster to pay for itself than wide detector general purpose scanners and requires 40% smaller room size. Visipaque is the only contrast media for intravascular use that is isomolar to blood at all concentrations. It is also the only FDA-approved contrast media for coronary CT angio. CT angiography is a great modality for anatomical testing, but to assess the functional impact on the left ventricle, there are other modalities better suited for this. The choice of functional testing typically depends on accessibility, preference, and experience. For the intermediate risk patient population, a negative stress echo may be able to reduce the need for additional testing and decrease cost of care. Our VIVID series include AFI stress protocols to quantify global and segmental strain for wall motion assessment at each stress level. Stress cardiac MR provides functional imaging that can be used to rule out or rule in ischemic coronary artery disease. CMR stress testing provides important incremental information about clinical risk factors and resting wall motion abnormalities for clinical decision-making, especially in patients at intermediate risk. SIGNA Architect Air enables patient-friendly exams with a large 70-bore, providing clinical versatility and comfort. Consistently better image quality with Air Recon DL that helps improve signal-to-noise ratio and image sharpness, assess reduced perfusion, viability, scar transmurality, and fibrosis. Myocardial perfusion imaging modalities such as single photon emission computerized tomography offers a great option to evaluate patients for presence of coronary artery disease that is flow limiting and causing ischemia. SPECT imaging is indicated for patients with high probability of coronary artery disease. Discovery NM is solely dedicated to cardiac imaging. It provides improved patient experience with up to 4 times lower injection dose. Recent advancements in SPECT technology have made it possible to enhance the clinical value of nuclear cardiology. Acceleris can confirm suspected triple vessel and microvascular disease. For patients with the highest likelihood of coronary artery disease, invasive coronary angiography detects and quantifies the presence and extent of coronary artery disease. Innova IGS and Alia IGS both have AutoWrite, our AI-based imaging chain. AutoWrite dynamically optimizes image quality and dose parameters in real time. By fully automating image optimization throughout the entire procedure, clinicians and technologists are relieved of tedious and complex tasks so that they can focus on the patient. Again, being able to document procedures with minimum effort is key. Centricity Cardio Enterprise can create normal left heart cath reports in just 5 clicks. Revascularization may be required for patients who present with chest pain. High-quality coronary angiography is key for maximizing percutaneous coronary intervention outcomes. PCI outcomes rely on successful balloon and stent deployment. Assuring appropriate stent placement and full deployment requires high-quality imaging. By combining Innova IGS with PCI Assist, complex coronary interventions can be made simple. PCI Assist can help improve visualization of stent deployment as well as anatomical visibility by up to 85% in moving arteries at the same dose, and up to 75% in larger patients. For complex PCI procedures, such as bifurcations, PCI Assist helps to increase accuracy of stent placement. In the cath lab, the MACLab hemodynamic recording system provides seamless interoperability. MACLab Altix provides a place for recording patient vitals and documentation at the point of care, reducing potential errors and saving time. Once documented, everything is exported to the EMR so that all data can be stored in the same location. Cardiac monitoring during interventions is important to quickly manage any arrhythmias and ongoing ischemia. Early identification of rhythm changes, ST changes, and Q wave changes is important to provide appropriate treatment and assure positive outcomes. GE's CARESCAPE monitoring portfolio analyzes 4 independent simultaneous ECG leads that help earlier and more accurately identify arrhythmias. Furthermore, interventional cardiology insights give better day-to-day inventory management and overview, including expiring inventory, physician cost per case, and inventory on hand. It helps optimize invasive cardiology operations by monitoring case volumes and case workflow times. Follow-up for patients who have had a myocardial infarction is important to minimize long-term mortality and morbidity, including risk of sudden cardiac death. Follow-up assessment depends on clinical status and may, for symptomatic cases, bring the clinical pathway back to detection, diagnosis, or treatment. Annual ECG and possibly less frequent echocardiography for assessment of LV function and valvular status can be beneficial. For patients who have experienced myocardial infarction, assessment of left ventricular function is recommended because depressed LV function will influence pharmacological therapies and may increase risk of sudden cardiac death, requiring additional intervention. Our Vivid scanners offers AFI with full automatic recognition of apical imaging views and measurements of GLS and peak strain dispersion, also known as mechanical dispersion. Mechanical dispersion has shown to have value to predict risk of arrhythmias in post-MI patients. A full set of reproducible measurements for assessment of LV enlargement can be performed automatically with new AI algorithms developed using deep learning. LV size measurements can be completed with 3 clicks. Freeze, measure, auto. A resting 12-lead ECG at 1 year or longer intervals between studies in patients with stable symptoms might be reasonable. ECG can identify LV hypertrophy and ECG repolarization abnormalities, which can indicate increased risk of mortality and morbidity. The Muse NX offers the ability to easily compare ECGs to quickly identify if any ECG changes are new or consistent with previous abnormalities. Smart Lead ECG helps minimize patient data mix-ups by automatically detecting when a new patient is connected. Smart Auto ECG reduces repeats by immediately capturing and displaying the first clean, high-quality waveform. Patients suffering from coronary artery disease require strong care coordination to assure effective secondary prevention and management, also post-treatment. Most patients with coronary artery disease are managed by multiple providers across the care continuum, including both hospital and ambulatory settings. To assure effective care coordination, all team members managing these patients require access to the patient's history, previous ECGs, imaging studies, and treatment plan. Centricity Cardiology Enterprise has been named Best in Class for Cardiology IT by KLAS, an industry-trusted research and insights firm. That completes the chronic coronary syndrome pathway and how GE Healthcare provides solutions for heart care teams to develop a systematic approach to disease detection and management across the continuum of care. We will continue to be your heart care partner as we develop new and innovative solutions to exceed your expectations. We believe artificial intelligence will disrupt current clinical workflows by predicting the individual patient's disease progression and empower care teams to make decisions with the best possible tool. Thank you so much for your attention.